Do you use a lot of imaging to support your diagnosis, or how much weight do you put on imaging? And if so, how frequently do you find that it helps as opposed to just a physical exam?
The next layer of when I'll get imaging is if things are really unclear to me. So if I do an orthopedic test on the low back and I can't recreate any back pain, then I'm gonna get an MRI to see if there is something a little bit deeper. So as an example, if there is some modic type 1 changes, so there's some inflammation in the vertebral bodies that could be contributing to pain, or if there's a small annular tear in the outer aspect of the disc that I'm not able to recreate on my physical exam. So when I'm kind of a little bit stuck on my thought process on things are not making sense, let's get some imaging to see what maybe we're missing. A lot of patients come to me with imaging, and so in those cases, I take a lot of it with a grain of salt, because if I were to treat just the things found on imaging, then they'd be in the exact same situation that they're in before they see me, because that's why they're seeing me. Because all the other docs have been doing stuff for their facet joints because they've got, some facet hypertrophy and some a little bit of fluid accumulation in their facet joints, but it's not their facet joints that are causing them pain, and so it's not doing anything for them. Or other common things where, a patient might have a small tear in supraspinatus, but on an MRI, but physical exam, their supraspinatus is rock solid and there's no pain coming from that. And it's actually more of an axillary nerve entrapment that's causing their shoulder pain, hence why the steroid injections they've been getting into their supraspinatus have not been helping them. And so again, I will take it with a grain of salt, but I will still look at it to see if there's anything that is glaring at me that I need to pay attention to or focus on.